Hello there, my name is David Thurtle. I'm one of the registrars in urology here at Peterborough City Hospital. I'm here today to go through information about your rigid cystoscopy and the consent form. So rigid cystoscopy means to look inside the bladder with a rigid telescope. We tend to perform this for a number of reasons, but most commonly it is for diagnosis of bladder problems. A rigid cystoscopy has the additional advantage that at the same time we can perform a procedure. That may be a biopsy if we find something suspicious, or removal of stones or clots from inside the bladder, or even sometimes to remove a tumour or remove a stent. A rigid cystoscopy allows the potential of all of these potential procedures. At the time of a rigid cystoscopy, we often perform an examination at the same time. That is to say, a prostate examination or a vaginal examination, depending on your gender. So what does this procedure involve? Well, a rigid cystoscopy is usually performed under general anaesthetic or spinal anaesthetic, and the anaesthetist will discuss with you this procedure. In terms of the cystoscopy itself, when you're asleep, we insert some local anaesthetic jelly through the water pipe and pass through the telescope. We then look around the bladder thoroughly to look for any abnormalities. If we find abnormalities, we proceed to take biopsies or remove them as necessary. At the end of the procedure, we usually empty the bladder. Sometimes at the end of the procedure, we will leave a catheter in place. This is if it's particularly bloody, if you had a catheter in beforehand, or if it was very difficult to get into the bladder. The catheter can allow healing of the water pipe afterwards, and it can ensure that the bladder is draining fully. What are the alternatives to this procedure? Well, we can perform a cystoscopy using a flexible instrument. This can usually be performed under local anaesthetic. However, it's far more difficult to perform anything else at the same time, such as biopsies or removal of stones. Sometimes the views are much poorer by doing a flexible cystoscopy, and therefore a rigid cystoscopy becomes necessary. In terms of after effects following on from the procedure, the vast majority of patients will go home on the same day as a rigid cystoscopy, even if they've had biopsies at the same time. However, there are many side effects, some which are common and some which are far more rare, which you should be aware of. Commonly occurring side effects are the sensation of stinging or burning when you first pass urine after the procedure. This may persist for a short time, but tends to settle on its own. It's important you drink plenty of fluid to reduce this. Other common side effects are a bit of bleeding or visible blood in the urine after the procedure. This can persist for a few days, but again tends to settle on its own and will settle quickly if you drink more. Other quite common side effects are infection of the bladder or the waterworks. The risk of this will be reduced by us giving you antibiotics prior to the procedure, and if there are concerns, we may give you antibiotics to take home after the procedure. Symptoms of an infection might be stinging, burning, a temperature, or feeling generally unwell, and you should seek medical attention if you're concerned of this. Less common after effects might be the insertion of a catheter at the time of the procedure. As I've already mentioned, this may be done if there's lots of bleeding, if you had a pre-existing catheter, or if it's very difficult to get into the bladder. Other risks of the procedure are that we may need to take biopsies clearly, and if we do take biopsies and find that you do have something sinister, such as a cancer, you may need further procedures down the line. Less commonly, you may have bleeding that persists even beyond a few days, and occasionally that may even require a return to theatre for another operation to stop the bleeding and to evacuate the clots. Even more rarely, the procedure can sometimes cause an injury to the bladder wall, which causes the bladder to open up. This is called a bladder perforation and is a very serious side effect. If this were to happen, it may be necessary to leave a catheter in for a long period to help heal the bladder, or it may be necessary for you to have a more major open operation to find the bladder and to repair it with stitches. This is very unusual, but it is a very serious and known risk. Finally, the procedure may long-term lead to injury or damage to the water pipe itself. You can get scarring, which sometimes requires further procedures or needs a catheter in the future. After the procedure, most commonly patients go home on the same day. We would usually want to see that you have passed urine before you are discharged from hospital. When you get home, you may feel uncomfortable on passing urine, but otherwise you should feel relatively well. You may have some side effects from the anaesthetic itself, and for that reason, if you have a general anaesthetic, you'll be asked to be supervised for the first 24 hours, and you shouldn't drive a car. After the procedure, the surgeon or someone from the team should come and explain to you what was found and what the plan going forward is. You are likely to also receive a letter following on from your procedure which outlines what was found and what the plan going forward is. If biopsies were taken, it can take a couple of weeks to get the results of these back, and the results will be communicated to you. Sometimes after 10 to 14 days after the procedure, you may get a second show of blood. This is common as the scabs on the inside come away at that point. It's important you drink plenty at this time to flush things through, and it usually settles on its own. If it doesn't, you may need to seek medical attention, particularly if you're unable to urinate. The vast majority of patients have very few problems after a rigid cystoscopy, and it's a very well tolerated procedure.